Hi, my name is Dr. Jessica Meers. I am a board certified sleep psychologist and I specialize in treating sleep disorders. Today I'm going to talk about how to get the most out of your treatment. Mostly I'm going to be talking about insomnia because that's the disorder that I see the most. And I'll start off by saying that anytime you're doing any kind of treatment, there are challenges involved in it. It's not always a super smooth, easy ride, but the outcome is definitely worth it. My number one piece of advice, and I tell this to everybody, one of the biggest and most important parts of your treatment is tracking your sleep. When we first sit down together, I ask you to complete a sleep diary every day, and I explain the benefits of that and why it's so important. And it really is super important because we use that information from that sleep diary to put together a plan of action. We use that to dictate what we will do. No, it doesn't have to be perfect. It doesn't have to be super precise, but I do need that snapshot into your night every night so that we can tailor the treatment to you in particular. Even if you're embarrassed that you didn't kind of follow through on some advice that I gave you or a recommendation, that's okay. It happens more often than not, and I'm not concerned about it, but I do need to know. So we do need that to be accurate to the best of your ability, not super precise, but also not a lie. And I don't want you to tailor it to make me happy because it has nothing to do with me. Additionally, this is a process, and in the process there are going to be ups and downs, and you have to be patient. The outcome, like I said, is totally worth it, but it takes time. It doesn't happen overnight, no pun intended, and we really need to kind of stick through and be consistent in order to see change happen. That takes sometimes several weeks, and we just have to go through the ups and downs of that. You may not feel progress right away, but generally I can see progress happening. Be patient with the progress. And also bring your whole self to sessions. I know generally when we're doing CBT-I and we're talking about insomnia, it can feel like you have to just stick to talking about sleep, but sleep problems are oftentimes started by stress in life. And so if you're going through a major stress or you're feeling really anxious or down, let's talk about it because it's probably impacting your sleep. And then finally, you're not failing if you are still feeling really tired. And sometimes we have to get more tired before it gets better. Know that it's working even if you're not feeling great right away. And know that it's not going to be easy peasy all the time, but again, it's totally worth it. All right, so in the comments, let me know if you have any questions or any parts of the process that still feel confusing to you, and I'm happy to answer them. All right, take care.